Today I'll be dealing with a case about a cheerleader who struggles with patella tendonopathy. The client is aged 19 and their sport is competitive cheerleading. For the subjective findings of this case, we've found there is gradual onset of anterior knee pain over 6 months. The pain is localised to the apex of the patella and there is stiffness after sitting. The pain is aggravated by cheer drills and running for over 5 minutes and is eased by rest. Furthermore, for the objective findings, we have found a slight valgus alignment in the knees and tenderness at the patella tendon. The quadriceps and hamstring strength is at a 4 out of 5. There's pain during inner range quadricep contraction, and they are unable to perform single leg squats or drop jumps due to pain. Patella tendinopathy, or jumper's knee, is an overuse injury that occurs in professional as well as recreational athletes. This condition is a non-contact injury typically characterized by gradually increasing pain in the patella tendon. It is prevalent in participants of several sports, but it occurs mostly in jumping sports.
Hi, my name is Billy Waymart. I'm a practitioner here at Cardiff. I'm currently here with a 19-year-old cheerleader who currently struggles with patella tendinopathy. We found out that the pain is localised in the apex of the patella and they struggle with single leg movements like split squats and lat strokes. Today I've chosen an isometric movement, which is a wall sit. So before we start, do I have your informed consent?
Yeah, of course, mate.
Okay, let's begin. So now I've gained your informed consent. I'm going to now do a wall sit for you. I'll show you an example. So what you're going to do, you're going to place your legs against the platform, squeeze your bum back, and squat down between a 60 and 90 degree angle and hold for 20 to 30 seconds. You just feel the lower in your quads, and if you fail, you can just sit down onto the platform. Movement I'll watch you continue. So just bend down and hold there, that's perfect. Make sure you feel the lower through your quads. How's that feel? Maintain, keep steady breathing, don't hold your breath. See how you can hold it for. When you fail, just pop yourself down.
An isometric wall sit is a beneficial patella tendinopathy exercise as it is controlled and it is a low irritation exercise. Because the position is static, it allows safe loading of the tendon without rapid movement or high strain rates, making it easier to tolerate in the early stages of rehab.
Right, so a progression of this movement could be holding a weight to add an extra load onto the patella. So what you want to do, hold it against your chest, sit your bum back in the same movement, and squat down, hold the weight, in the exact same movement. And when you're done, just drop the bum down. So you feel the same, just with some extra load.
Holding a weight during a wall sit is a very effective progression as it increases the controlled load on the quadriceps and patella tendon, helping build strength and low tolerance as rehab progresses, while maintaining a stable, pain-managed position. Furthermore, pushing isometrics are used to build force output and muscular endurance, while holding isometrics are used to challenge motor control, joint stability, and proprioceptive capacity.
Hold the plate in against your chest. Out of 10, how much would you say that hurts?
Probably like 5 out of 10.
Okay, that's great. You feel it within the quads?
Yeah.
Hold that for as long as you can. Right, so lastly, we're going to be performing a regression of this movement, which is increasing the angle of the wall sit. This is good because it can reduce the tension and the load on the knee. So same sort of movement, you just want to sit your bum back, you just stand at a higher angle this time. So you should feel the reduced tension in the patella. So if you want to perform that, you just want to sit at a higher angle. Yeah. How's that feel? Does that feel like reduced tension?
Yeah, definitely, yeah.
On a scale of 1 to 10, what do you think it is this time?
Probably about 4 out of 10.
Obviously, if it gets too hard, you can increase it a little bit more.
Increasing the angle of a wall sit will reduce the knee flexion, which will lower the quadriceps demand and decrease the tensile stress on the patella tendon, making the exercise more comfortable during early rehab. This will allow the individual to continue benefiting from isometric loading while managing symptoms and building tolerance for future progression.